Good afternoon, everyone. I have some updates today with respect to COVID and also some comments on the federal election. But first, I'd like to point out that today I appointed Jason Kenney as Minister of Health and Tyler Shandro as Minister of Labour and Immigration. I want to thank Tyler for his service to Albertans over the last 2 incredibly challenging years. When I asked Tyler to serve as Health Minister in April of 2019, nobody could have predicted the crisis that he would be tasked with taking on. But as elected leaders, we don't get to choose what challenges will come our way. We can only do our best to work hard to address them. Tyler's dedication to the job and to serving the people of Alberta has never been in question. He's one of the hardest working people I've ever known, and he has brought his heart to his job. For example, by working hard to expand insurance coverage for very expensive medications for rare childhood diseases. However, as this crisis evolves, so too must our response to it. And so I have accepted Minister Shandro's resignation as Minister of Health. It is time for a fresh start and a new set of eyes on the largest department in the government, especially at a time such as this. Minister Kenney has proven himself as a thoughtful and capable leader in government who is ready to take on the daunting task of overcoming this 4th wave and preparing the healthcare system to deal with whatever the virus throws at us in the future. Minister Shandro will continue to serve at the Cabinet table as Minister of Labour and Immigration. He will lead the implementation of the Alberta Advantage Immigration Strategy and the Fairness for Newcomers Action Plan, while working with other ministers to advance our Skills for Jobs agenda to address the emerging labour shortages in many parts of Alberta's economy. Turning now to COVID-19 and our efforts to overcome the 4th wave. Last week, I told Albertans that we had no choice but to make necessary and critical steps to prevent our health system from being overwhelmed and, once again, to slow the spread of COVID-19 in Alberta. As I said last week, we must urgently do 3 things. First, increase hospital capacity, particularly in intensive care units. Secondly, increase the number of vaccinations in Alberta. And thirdly, reduce viral transmission. That is why we declared a state of public health emergency with limits on private gatherings, entertainment facilities, retails, and other activities. But it also included the introduction of the new restriction exemption program, or the proof of vaccination program, which I believe is off to a strong start. I'm pleased to report that in the 72 hours after we announced this program, more than 78,000 doses of COVID-19 vaccine were administered. And the momentum continues, with more than 23,000 doses administered yesterday. As of today, 81.4% of eligible Albertans have now gotten at least 1 shot, and 72.8% have gotten 2 shots, both sharp increases from just over a week ago. In fact, since we launched the $100 incentive for people to get vaccinated about 3 weeks ago, we've seen over 120,000 people step up for their first shot, which has increased that share of the population by about 3 percentage points. Very important protection for those people, their loved ones, and our whole healthcare system. I'm also pleased to say that over 2 million Albertans have gotten their proof of vaccination cards since Sunday. And I'd like to pause to thank the tens of thousands of businesses and different organizations who are working hard right now this week to comply with the restriction exemption program. Earlier today, I held a number of meetings with, for example, the Chambers of Commerce, the Association of Petroleum Producers, and other business organizations, partly to address the implementation of the program, to thank them for their cooperation, and also to encourage them to in turn encourage their employees to get the protection of vaccination. As well, I am pleased to report that the reproductive rate of COVID in both the Calgary and Edmonton health zones dipped below 1 last week. This is small, but still important progress, and it reminds us all that we can get through this if we do the right things. But I must be clear, we still have a long way to go. We know it'll take time for the health measures that we put in place last week to bend down the curve and stop the spike of hospitalizations that could threaten our health system. Alberta Health Services continues to do all that it can to increase capacity in our health system, particularly in intensive care units where pressure is most acute. Currently, we have 337 beds available in Alberta ICUs, including 164 surge spaces that have been created. AHS has opened 37 additional surge spaces in the past week. There are currently 293 patients in ICU. I should say that, fortunately, over the past week, we've actually seen a slight decline in the number of COVID ICU patients, but unfortunately, a significant increase in non-COVID ICU patients. Particularly this weekend, there appears to have been a number of admissions related to drug overdoses, a reminder that COVID is not the only public health crisis that we are facing in Alberta. Nevertheless, with 293 ICU patients, the vast majority of whom are COVID positive, some 90% of whom are not vaccinated, this is a very serious pressure on the system. Provincially, ICU capacity, including these additional surge beds, is currently at 87%. Without the additional surge spaces, provincial ICU capacity would be 169% based on our normal baseline. That is why Alberta Health Services has already reached out to other provinces for help with staffing and to explore, if necessary, potentially transferring patients to provinces with spare capacity, just as we in the past have accepted patients from other provinces when we had spare capacity and they were in need. And over the past several days, I've spoken to almost all of the premiers across the country, partly to compare notes. We're all facing similar, in many cases, very similar challenges. We're all facing capacity challenges in the healthcare system, and I want to thank all of them for their solidarity and cooperation. It is also why earlier today we initiated planning with federal agencies for potential additional support, again, to plan responsibly for a worst-case scenario. Our planning includes a potential aeromedical evacuation capability from the Canadian Armed Forces, including getting more personnel skilled in patient management and transfers that can help support relocating patients to hospitals outside of the province if needed. Let me be clear, we do not currently need this support, and we do not have an imminent need of it, but it's prudent to plan for things in case we reach a worst-case scenario. Today, I'm also announcing that, effective immediately, Alberta will be expanding the groups of severely immunocompromised Albertans who are eligible for a third dose of vaccine. Dr. Hinshaw will give you details in a moment, but this move brings Alberta in line with National Advisory Committee on Immunization recommendations and protects those who are uniquely vulnerable due to advanced HIV infections and other conditions. Third doses of COVID-19 vaccines are also available for seniors living in congregate care, and I urge everyone in these settings to get their third dose. And on Friday of this week, the Alberta Advisory Committee on Immunization will be meeting in part to review whether we should expand access to booster shots to other vulnerable populations. Finally, before I invite Dr. Hinshaw to speak, I would like to congratulate Prime Minister Trudeau on the re-election of his minority government last night. I'd also like to congratulate all members elected to the House of Commons and to thank the hundreds of candidates from all parties and the tens of thousands of election volunteers for their commitment to Canada's democratic process. We will get down to work with the Government of Canada and all parties in this minority parliament on issues that matter to Albertans, which first and foremost means getting through this fourth wave of COVID. And one key lesson of the COVID era is that we must expand the capacity of Canada's healthcare system. That's why Alberta's government has joined all of the provinces in calling for a significant increase in the Canada Health Transfer to reflect these pressures and rising healthcare costs. I look forward to discussing this urgent priority with my fellow premiers later this week at a virtual meeting of the Council of the Federation. Alberta's government will also continue to fight to secure a fair deal in Confederation, beginning with much-needed reform to the federal equalization and fiscal stabilization programs. Economic recovery coming out of this period must include all regions and all industries and all workers. And that means as well Alberta's energy sector the largest sector of Canada's economy. And with that, I will now invite Dr. Hinshaw to say a few, oh, I'm sorry, excuse me, actually Minister Copping, who is his first appearance as Minister of Health, will now say a few words.
Thank you, Premier. Good afternoon, everyone. I am profoundly honored to be asked to serve as the Minister of Health during this pivotal time for Albertans. And I want all Albertans to know that I am deeply committed to helping steer the province through this current crisis and on to better days. I'd also like to thank Minister Tyler Shandro, my colleague, for his dedication to the health and well-being of Albertans through these unprecedented times. We obviously have immediate and significant pressures on our healthcare system right now, and I step into this role resolutely committed to building immediate capacity. However, we also know that COVID-19 is not likely to go anywhere anytime soon. But today I would like a commitment to look forward. I'll be working on 3 key issues to shift how we manage COVID-19. First, increasing our baseline hospital capacity permanently. Second, educating vaccine-hesitant Albertans to get more Albertans immunized. And third, preparing our health system to more adequately respond to potential future waves of COVID-19. I know there are many questions of how, and there will be details to come on that. But for now, I will be stepping into this vital role and executing on these priorities. The pandemic has changed our world. It's touched the lives of every individual, family, and community. It's not what anyone would have wished for our future, but it is our reality. We must adapt and change to live with COVID-19. We have learned much in the past 18 months. We have much more to learn. Now, I'd like to start with one of the items on my priority list right now and ask anyone who has not been vaccinated to talk about it with a health professional. Many people have questions, and that's okay. It's good to question. Just be sure to place your trust in the experts for your answers. Alberta Health has a resource information available at alberta.ca/COVID-19. I encourage you to seek answers here and discuss any issues with your doctor. In closing, I want to urge all Albertans to stay strong and stay united. I know this has been an incredibly tough journey, and it's been much longer than any of us wanted it to be. Please be kind to yourself and be kind to each other. Listen to one another. And remember that Alberta is a strong province. Albertans are a tough people. We will persevere, and we will get through this together. I'd like to thank again the Premier for putting his trust